Hello, today we are going to discuss about the anastomosis around the elbow joint. It is the arterial anastomosis around the elbow joint which helps recirculate and distribute the arterial blood supply to the elbow joint around its structures. So it is formed by various branches coming from mainly the brachial artery and its branches. So we'll see in this is a schematic diagram of anastomosis around the elbow joint. Okay, so let us orient ourselves to this diagram. This is the axis where this is the medial, this is the lateral, this is the proximal, this is the distal orientation of this diagram. This is the humerus bone, this is the radius bone, and this is the ulnar bone. So proximally the elbow joint is formed by the humerus bone, distally by two bones. In the distal aspect, the laterally by the radius and medially by the ulnar bone. So let's see what are its arterial supply around the elbow joint. The main artery which forms this anastomosis is the brachial artery. This is the brachial artery which lies on the medial aspect of the humerus bone. The first branch of brachial artery, which is the profunda brachial artery, lies on the lateral aspect of the humerus bone. This is profunda brachial artery, which is the first branch of brachial artery. On the medial aspect, there are two branches from the brachial artery, that is the superior ulnar collateral artery and the inferior ulnar collateral artery. On the lateral aspect, the profunda brachial artery will give two branches, that is the anterior branch of profunda brachial artery and posterior branch of profunda brachial artery. Okay. The brachial artery divides into two arteries beyond the elbow joint, that is on the medial aspect it is the ulnar artery and on the lateral aspect it is the radial artery. So what happens? These divisions of brachial artery or the branches of brachial artery will give recurrent arteries which anastomose with the so mentioned we discussed arteries in the proximal aspect of this elbow joint. What are those? Let us see. So medially, the superior ulnar collateral artery anastomose with the anterior branch of ulnar recurrent artery. Okay, this is the anterior ulnar recurrent artery which is anastomosing with the superior ulnar collateral, and the posterior ulnar recurrent artery anastomose with the inferior ulnar collateral artery on the medial aspect. Coming to the lateral aspect, in the lateral aspect, of course, it is the radial artery which is lying on the lateral aspect with respect to the radius bone, but there is a difference in this. What is that? The ulnar artery will give rise to a common intraosseous artery which will divide into anterior intraosseous artery and a posterior intraosseous artery. These are the branches which is in turn a branch of common intraosseous artery which is in turn branch of ulnar artery. Okay. So as earlier we saw on the proximal aspect, profunda brachial artery is giving two branches, that is anterior branch of profunda brachial and the posterior branch of profunda brachial. So anterior branch of profunda brachial artery anastomose with the recurrent branch of radial artery. Okay, and the posterior posterior profunda brachial artery will anastomose a branch coming from the posterior interosseous artery, which is the recurrent interosseous artery, or you can say recurrent posterior interosseous artery, and they anastomose the. These are the main lateral longitudinally arranged branches which anastomose around the elbow joint. Other than this, multiple horizontal anastomosis also occur between these branches ventrally and dorsally respectively. So in a small schematic way, this is the arterial anastomosis around the elbow joint. Hope you all understood this concept of anastomosis around the elbow joint. Thank you.